And without any further ado, it is my honor to introduce for you the Honorable Dr. Terry Lake, who is the Minister of Health of British Columbia and brings to us a message from the Premier of British Columbia. Dr. Lake was appointed Minister of Health in June 2013. He has served as Minister of the Environment, and prior to that, he served as the Parliamentary Secretary for Health Promotion to the Minister of Health Services and the Parliamentary Secretary for the Ranching Task Force to the Minister of Agriculture and Lands. He also sat as a member of the Select Standing Committee on Health and on Legislative Initiatives. He's a doctor, but of the other kind. He's a veterinarian by profession. He has served as a mayor of the city of Kamloops from 2005 to 2008, and as a city councillor prior to that, starting in 2002. Please welcome Dr. Terry Lake, who has been a tremendous supporter for the work that we do at the Centre.
Well, thank you very much, Julio, and welcome everybody. It's a pleasure to be here with you this afternoon in Vancouver, beautiful Vancouver, on the traditional territory of the Coast Salish First Nations. And on behalf of Premier Christy Clark, I want to welcome you to the conference here this afternoon, and welcome to Dr. Luis Flores, Deputy Executive Director of UNAIDS, and Minister Modeste Kerwin from Grenada. Welcome to Vancouver, and it's a pleasure to be on the panel with you here this afternoon. Our Premier, as you well know, is an extremely supportive proponent of what we're doing here in British Columbia, the Centre of Excellence for HIV/AIDS, and the work of Dr. Montaner and his team. And I'd like to say thank you to a couple of our ministry people that are here, are so supportive, Arlene Payton and Chiro Pennison, who are just great support for me. I can't do my job without really good people in the ministry, and I want to thank them for all they do for the province of British Columbia. As you well know, if you are from out of British Columbia, certainly if you are in British Columbia, you know that this province is recognized as a global leader in the fight against HIV/AIDS. HIV/AIDS related deaths in BC have decreased by more than 90% since 1996, and over the same period, new HIV infections per year have dropped from 900 in the mid-1990s to only 238 in 2012. Our government remains deeply committed to working to reduce the spread of HIV and ensuring that British Columbians living with or vulnerable to HIV are reached by the very best prevention, testing, care, and treatment services available. Harm reduction programs such as Vancouver's Insight Safe Injection Facility and other regional services are a key part of our public health approach to problematic substance use and communicable disease prevention. As part of BC's comprehensive disease prevention programming, the Ministry of Health funds a wide range of these programs and services, including needle distribution and recovery, methadone maintenance treatment, and, as I mentioned, supervised injection services. Our continued support for a distributed model of needle exchange is an integral component of preventing HIV and hepatitis C and engaging vulnerable populations. It's estimated that 3,500 British Columbians are unaware of their HIV status, but we know that diagnosing HIV infection early and providing treatment to willing and eligible individuals improves the health of patients and reduces the likelihood of HIV transmission. Beginning in April 1st of 2013, our Treatment as Prevention program called Seek and Treat for Optimal Prevention of HIV/AIDS rolled out across the province thanks to a $19.9 million in annual government funding. That program supports the health system and community partners to better reach and engage all British Columbians, including those most vulnerable groups, including those that benefit from HIV prevention, from testing, treatment, and support. And you know that that program followed on the heels of an initial 4-year, $48 million pilot program in 2009 that focused here in Vancouver, but also in Prince George, which is, for those of you not from British Columbia, a smaller regional city in the north of the province. So that expansion is being carried out by the health authorities throughout British Columbia with support and leadership from the BC Centre for Excellence in HIV/AIDS, who are monitoring and evaluating the success of the program. BC has developed a framework for the incorporation of the treatment as prevention strategy into best practices for HIV prevention throughout the province in a document called From Hope to Health Towards an AIDS-Free Generation. And the goals of this program are to reduce the number of new HIV infections, to improve the quality, effectiveness, and reach of HIV prevention services, to diagnose those living with HIV as early as possible, to improve the quality and reach of HIV services for those living with and vulnerable to HIV, and to reduce the burden of advanced HIV infection on the health system. As you know, the success of the treatment as prevention strategy is being recognized beyond the borders of British Columbia. It's been adopted by countries around the world, including China, France, Brazil, parts of the United States, and Spain. And in February, I was very pleased to welcome Panama to the list of countries that have signed a Memorandum of Understanding to adopt the treatment as prevention strategy in their fight against HIV/AIDS. Our success in the prevention and treatment of HIV/AIDS is in thanks, I think, in large part to the work and the efforts of the talented people and fine institutions that call British Columbia home, and that includes the St. Paul's Hospital Foundation and St. Paul's Hospital, the BC Centre for Excellence in HIV/AIDS, health authority partners, public supporters, and dedicated workers who work tirelessly to help those with HIV/AIDS. As the Stop HIV/AIDS program expands across the province, more British Columbians who are living with HIV are being identified. And by identifying these individuals early, we can treat them more effectively and improve their overall health. By expanding access to HIV testing for everyone, not just the vulnerable populations, we will reduce the transmission of HIV. And this routine testing represents a shift from focusing on high-risk patients such as IDUs to a more comprehensive approach. It reduces the stigma and increases the opportunities for treatment as prevention and leads us to our goal for an AIDS-free generation. Thank you all for being part of that progress towards an AIDS-free generation. I wish you the very best over the next few days and hope you enjoy your stay here in Vancouver. Thank you very much.